This is Scott Carson, founder and CEO of Powered by MRP, and also the host of MedTech Marketplace. Over the years, I've done numerous podcasts and lectures within the medical community, but the upcoming discussion is by far the most important discussion I've ever had. In the episode, we shine a light on a topic often overlooked: human trafficking. Joining me are two remarkable individuals dedicated to changing human trafficking, Dr. Ron Chambers and Jeanette Diaz. Dr. Chambers is a distinguished figure in the medical community, serving as program director at Methodist Family Residency and chief of staff at Methodist Hospital. He's also the medical director at Dignity Health Human Trafficking Medical Safe Haven, spearheading efforts to provide global comprehensive care to survivors. Jeanette Diaz is a survivor, and she will join us to share her lived experience, offering invaluable insights into her journey of recovery. Together, the three of us will explore the intersection of healthcare and aesthetics in healing trauma and helping survivors reclaim their lives through initiatives like Medical Safe Haven and the MRP movement. Dr. Chambers, I would like to hear more about some of the statistics regarding human trafficking, both domestically and globally, and how some of the global human trafficking issues are impacting the U.S. currently with some of the border issues that we're hearing so much about in the news today.
Sure. So it's an interesting thing when we talk about statistics in human trafficking, and the statistics are really difficult for us to wrap our heads around. It's an illegal underground issue, right? And so it's always difficult for us to get accurate data on the prevalency rates, on the average age of onset. So many different factors come into play, but I would say that working in this field for many years now, the one kind of take-home message I would give you is that I never see a new study come out where those rates go down. They're always expanding as we have more information and as more information is gathered from, again, like both nationally and around the world. I think some important statistics, though, that really apply to me and my patient population is kind of just, again, thinking like even from a medical standpoint in the lack of education and training we have in human trafficking. If we think about statistically, a teenage female in this country this year is probably about 40 times more likely to be trafficked than she is to die in an automobile accident, and about 100 times more likely to be trafficked than she is to commit suicide. And that's kind of eye-opening for me as a medical provider in primary care, especially. I'm taught in medical school, reinforced in residency, that I'm supposed to talk to all of my patients about suicide prevention, about automobile safety. It's part of our biopsychosocial exam on our adolescent patients. And so while those concepts, those ideas are reinforced throughout our medical education, there was nothing that ever taught me to talk to my patients about trafficking. And here it was, a problem incredibly more likely to be affecting them in their lives. And, concurrent with that, there's lots of studies that indicate medicine has this opportunity where others in society don't. There was a study in the Annals of Health Law where 2014, 88% of sex trafficking survivors recovered from the trafficking situations reported that they, saw a physician while they were being trafficked. None of them had interventions done. 77% of sexually exploited youth in Oakland, California, not only see their doctor, they see their doctor regularly. A third are on prescribed meds and have been hospitalized. So, these numbers tell us there's this incredible prevalency rate and this dearth of education and training in medicine on the issue. And, again, if you want to get into the statistics about labor trafficking and in border states, Texas has some very good data on that, the hundreds of thousands that come through. And even when you extrapolate to into the international world, I've worked in Africa, I've worked in India, where they have the highest human trafficking rates, in the world. And it's an incredible issue globally. We were working in regions in northern India where the entire infrastructure was based, basically on trafficking. And in the ICUs, we basically were treating patients that were suicide attempts, trying to get out of their living situations, from trafficking. So this is definitely a domestic problem. It's definitely a global problem. And I do think that any type of, vulnerability, such as a migratory status, is going to increase the risk for that patient population. I would say, though, that one of the really, really crucial pieces of information that always has to be brought into this conversation is how this really is a very insidious process, or, within our community. This isn't something where somebody's always being kidnapped and brought in. That tends to honestly be the one-off. I Some important numbers that I always find very much, you know, consistent with the patient population I see is that if you look even at the National Justice Incidence Study, there's going to be about 1.7 million kids that run away in this country each year. Out of that 1.7 million, about 357,000 on average get reported to the police. And again, that's an interesting statistic because that tells you that 21% of kids get reported to the police. 79%, they're coming from home environments where their loved one, their caregiver, whoever's supposed to be watching over that child, doesn't even bother calling the police, right? So these are homes of abuse and neglect. And that kind of developmental upbringing leads to so many of the ramifications that we see long term happening with trafficking. And so much of what brings people, even when we recover them from trafficking situations, ending up back into trafficking situations through the developmental attachments they build through trauma bonding, trauma coerced attachment, and other concepts that we can talk about. But those are kind of some of the more common statistics I use. I know one that gets brought up a lot, that you see a lot in the literature that you see, if you kind of just go online, people will say, well, what's the average onset? How old is somebody typically when they begin being sex trafficked? And I base my experience on, we have over 5,000 patient visits. We're almost 6,000 patient visits in. And I will tell you that most of the patients I see report to me, at least in sex trafficking, that they first were sold for sex somewhere in their early teenage years. Sometimes it's middle teenage, sometimes it's late or early 20s. If you get past mid 20s, it tends to be the one-off kidnapping situation. But if I were to take, all of the stories into account and just look at the single number that I've heard most commonly, and I'm not going to say it's the average, but it's the single number that I've heard most commonly when people say, when do you remember, first being sold for sex? It's age 5. And I've heard the number 5 so many times. I've given a lot of thought over the years. And I honestly, it's probably when we can actually even start to formulate memories within this context. But usually that situation involves the mom, and she's usually selling the child for drug money to the guy across the street, down the hall, putting her in the trunk of the car and driving around town. And I think that this is an important piece of this story, though, because what we really need to recognize is, again, how insidious this is and how it's so embedded in our society and happening all around us each and every day. And then we start to actually recognize the prevalency rates and start to see that we really do need to do something about this kind of, on a societal level.
Just in children, the statistic that you gave was roughly almost 1.5 million are not reported missing. Is there any correlation to these children that are not reported missing and the incident of sex trafficking within that group? Do we have any data that supports that, or give us an idea of the magnitude of the problem within that group?
Yeah, there have been studies on that, and they range pretty wildly. 1 to 300,000. 1 in 7 that hit the streets end up being trafficked. It's something that we see and hear a lot. I work, very closely with law enforcement, FBI, and a lot of the community agencies that deal with domestic violence and human trafficking and safe housing, and it's just such a common story that we deal with over and over again. That kids coming from these backgrounds of abuse and neglect, somewhere in their early teenage years, they get fed up with it. And so they run away and they hit the streets, and the traffickers absolutely know where to pick them up. In fact, here in Sacramento at the Child Receiving Center, kids have the legal authority to sign themselves out. And the traffickers literally sit across the street in the Denny's and IHOP and watch them and wait for them and pick them up. And, for law enforcement, it's a game of whack-a-mole. It's a very difficult problem when it's so prevalent and widespread. But then we end up going through that whole situation, that I was a little bit alluding to. The trafficker, when they pick up that child, they very often go through a period of trauma bonding them and grooming them into being a trafficking victim. And so we start at a very early age of developmental trauma, leading into very often runaway status, leading to trafficking situations. Absolutely.
You shared with me previously and other calls and conversations that we've had as we've kind of worked together to develop a program to address and help these victims. You shared some examples of how these victims are groomed and how they're treated and mistreated to become these pawns of these sex traffickers. Can you give some examples, because they're frankly horrifying, and I think we're trying to bring awareness to this issue and also show the path that we have to take this 80% of the people that currently can be recovered and accelerate that, and also try to get the other 20% some care. And so can you speak about how these young people are groomed by these sex traffickers?
Yeah, no, absolutely. And honestly, we've published some pretty meaningful papers, in my opinion. We got some good awards on this about how this process occurs and how we can try to mitigate some of the ramifications of it. But it's, I a story I commonly use when I'm speaking on the matter, and it's one that I hear variations of all the time. Is, again, we think about kids coming from these homes of abuse and neglect, developmental trauma. They hit the streets. The traffickers know exactly where to pick them up. And so you've got a 12 or 13-year-old runaway who's picked up by a trafficker, and he'll take her home, and he'll be very nice to her for a while. He'll buy her gifts, take her to dinner, buy her new clothes, to, get her nails done. And then at some point, though, that trafficker gets mad and he'll just beat the bejesus out of her, and he'll drive her out in the middle of winter here in Sacramento. Be freezing rain out. He'll go off Auburn Boulevard, bad part of town, behind the warehouses along the railroad tracks there. He'll strip her naked. He'll dump her on the railroad tracks. He'll do something awful like pee on her. And he'll get in his car and he'll drive off. And, the hours go by. And you've got this 12, 13-year-old, kid, and they're naked, they're freezing, they're beat up, they just got peed on. And it's not like law enforcement knows they're there. They don't have the ability to swoop in. It's not like medicine. We know they're there and we're swooping in to save them. But, who do you think comes back to get this child? It's going to be that trafficker, right? And he takes her home and he draws her a warm bath and he takes her to dinner and he buys her a new dress. And, you think about the psychology behind that, because this doesn't happen once or twice. This happens over and over and over again during the developmental years of this person's, upbringing. And if you think about the ramifications of that in of itself leads to something that we term trauma bonding. I actually prefer the term trauma coerced attachment. It's got a little bit more of a medical spin on it, but I would argue fully that treating enough this patient population, that trauma bonding ties this person to that trafficker as strong as any metal chain would. And so I think that's part of the misconception that we have to deal with right off the bat with this patient population. Is so many people walk into this conversation and they say, well, why don't they just leave? Or if you get them out, you got them into a safe house, job done, pat yourself on the back, wash your hands at the care of that patient. We're dealing with people with days, weeks, months, years, decades of trauma, abuse, exploitation. Like, they need our ongoing help. And to be able to mitigate those factors, to help them work through that trauma bonding and the complex post-traumatic stress disorders symptoms that they're going to have from that, it's absolutely crucial. And getting to the point you made about, how important is this piece? It's working with some of our local agencies. We have a wonderful agency in town called Communities Against Sexual Harm. And we did a study with them because they have a very robust anti-trafficking program that's partnered with the district attorney's office. And basically, if somebody gets into their program off the street, they're going to be, put into safe housing. They get educational plans, employment opportunities. They get all of these wraparound services that might take 18 months, might take 3 years to get through. But by the end of it, they've established a safe, living environment, a stable way to earn income. And so basically they're out of the trafficking situation. Their success rate on average is about 15%. With all of the services they offer, that patient's already out in a safe living environment. That means that 85% are typically ending up back into trafficking situations, 85%. And why is that? A lot of it is because if you think about somebody whose entire life has been fight or flight response, it's all stress hormones, it's all pedal to the metal, foot on the gas, and they get out and they're put into a safe living environment, and they're hearing crickets at night. Not only is that incredibly unfamiliar, but all of a sudden you have a withdrawal from all of these stress hormones, which have kind of stress-induced reward pathways have been built. And this person is now going to, of course, run back into that trafficking situation, fight or flight back into it, reinstigate that intense lifestyle. And so their success rate being that low has been, a big problem with the treatment of this population. When we've worked with their same patients, what's been a really exciting part of this work is that we created in our medical space what's called a medical safe haven, where when patients are identified either in the hospital settings by ourselves, if they're brought in by law enforcement, community agencies, safe houses, they get brought right into us, and we institute a whole different paradigm of care for this patient population that really mitigates a lot of the post-traumatic stress disorder symptoms they're having. And what we found is that if they're brought into our clinic right off the bat like that, their chance of completing CASH's program, which can you extrapolate to like getting out and staying out of trafficking long term, goes up 437%. Now that's a crazy outcome in medicine. Like you never get an outcome like that. We're happy if we get a 5% increase in something, right? 437% is unheard of. And we actually it's got a very low p-value, high statistical significance. And we did survival analysis, same population, same demographics. If they were brought to other medical centers, this did not occur, and so there's a lot that goes into this work. We use a lot of medication adjunct short term to mitigate their symptoms. But basically, if I can take away the nightmares, if I can decrease that stress hormone release, decrease the emotional ability, I'm buying them a day and then a week and then a month where their community agencies can continue that work and really get those patients on long-term roads to recovery. So this model has become so successful in our clinic that we've, again, published papers on it, and we've been able to replicate it now at 5 different locations within California, and we're in the process of working it across the country because this really is something that needs to spread, and a big piece of this patient population's care and the road of recovery to success.
I want to dive into the work you're doing in a little more detail, but I have one final question on the statistics and magnitude of the issue. We spent some time talking about the communities that you're speaking about, that there's a greater likelihood for young children to be, or young adults to be trafficked. But this sex trafficking and human trafficking, it happens in all aspects of regions and counties and cities and demographics. Can you speak a little bit to that? Because I think what my experience has been in working with you is we see this all over the U.S. This is not limited to just lower income environments and where there is gangs and pimps. This has a much broader reach.
Oh yeah, no, I mean absolutely. The demographics of our patients absolutely cross the entire sector of our society. It's all age groups, all different ethnicities, cultural backgrounds, all different socioeconomic status backgrounds. We see people from all walks of life. And it is important to recognize that this is happening, in many, many industries that are considered legal and legitimate, happening around us all day, every day. We have lots of labor trafficking patients we see coming to us from construction sites or farm work. We have, sex trafficking patients coming to us from lots of things, industries that are considered legal and legitimate, strip clubs, massage parlors, online escort services. The vast, vast majority of my patients have been bought and sold on online escort service websites, and those are, again, all across the country. It's a very interesting thing that, if I'm giving a presentation in Nebraska or wherever it may be, people will say, oh, this is a scary topic, but it's not happening here, luckily. Like that's probably happening East and West Coast or the big cities. And whenever we run into that, part of the conversation, what I always have people do is I say, take out your cell phone. We're going to find a 13-year-old being sold for sex, probably within about a half mile of us. It's going to take us about 30 seconds. And people don't believe it. And you can open up a million websites I can point them to. We can do it and they can see it's right down the road. We can find somebody right there and it will take seconds to be able to locate somebody. And then they'll see the listings. There's hundreds of them. And we can talk about in the listings, the things I could look for is a buyer of sex, is a John, a David, trick. Those are the terminology used very often. Growing heart emojis tells me that I'm purchasing somebody that hasn't gone through puberty yet. So there's all of these nuances to the conversation. But again, just to your point, the biggest piece of the conversation usually is this is ubiquitous across our society, but it's illegal underground, and so it largely goes unrecognized. And that is one of the problems of becoming educated in this, is you absolutely will start to see people all around you, in front of you at the self-checkout line at Target. I see people, couple in the grocery store, it's all around you every day.
I every time we speak, I'm just struck with the emotion of the significance of the problem. And one of the things I speak and write about currently is the speed in which technology is outpacing regulatory and legal environments. It's becoming exponential, and we're every day learning more about artificial intelligence and machine learning and device learning, and it's growing so quickly and so fast. There's no government agency that can keep up with that technology advancement. And this is something that I don't think people quite understand. This problem's going to get bigger because technology is going to get more efficient and more cryptic. And I think this is a really scary part of it. It crosses all demographics. It's a global problem, and technology is going to enable it to work much more efficiently. So I think that's a place for us maybe to pause, because I think we've explained the magnitude of the issue well. I think it's interesting here for me to you don't go to medical school with this obviously desire to focus on human trafficking. So where did that pivot come from, where this has become obviously a big part of your practice and your care? And frankly, probably your mission in life is to address this issue with awareness and treatment, and bring it out to both domestically and globally, that we'll get to in a minute. But where was that pivot point, and what was the motivation to get you to focus on this?
It was the first patient I saw that had been trafficked. I mean, it is, you're right. It's an interesting thing. You don't think about it. I mean, unfortunately, I can tell you that I've had the situation where, before even being you're educated or trained on it, I saw people that were being trafficked and had no idea. And there was a patient that I saw early on when we started this work, and she was 18 years old. She was being trafficked the night before, and law enforcement had picked her up, brought her to a safe house, and they brought her in the next morning. And she was coming in 18 years old with her 5-year-old child. And I was going through her history, and we're talking and stuff. And where's the child born? And she's like, oh, he was born here at a hospital across the street. And I looked back through her medical records, and 5 years prior, guess who delivered that baby? It was me and my team. And, we had a 13-year-old at the time, marijuana positive. We asked all the questions, got social work involved. We did everything right. We tied up we discharged them with a bow on it. Like, we covered all of our bases. We thought this was a safe discharge. We actually readmitted the baby a month later for an acute life-threatening event. And again, 13-year-old mom, marijuana positive. We did through all these hoops and stuff. And then we ended up, again, very safe discharge back home. What was amazing is, through that history, we discharged her back to her trafficker both times. And not only did we do that, but we did it documenting in her chart all of the warning signs and symptoms I could possibly hope for, to know that she was being trafficked. I mean, down to the tattoo, on her neck. So it's kind of like being uneducated on the issue leads to these misses. But once we were educated, my feeling is once you treat a patient, once you see what this person's been through, I mean, the level of empathy of understanding that I can't understand what they've been through is really important to me. But once you see that first patient, I think most people have an automatic, reaction. I have an obligation to do something different, to do something about this. And it's an incredibly vulnerable part of our society. So I think that's the pull.
So I think I've heard this. I've heard you explain this before, and each time I've heard it, and again, it's one of these things that just resonates to your core. So what you're saying is that most physicians have no training on what the signs are. So you're trained on the medical issues, but not on any of the other issues. So you follow the playbook, the education you're provided over the years, many years, in some cases, 20 years of education to get to that point where you're actually treating these patients. But none of that education really prepares you for what you're seeing. So you really don't know what to do. And it was as you started to see this that led to really this kind of medical safe haven project that you started to get involved in, or probably the spine of it, where you could begin to educate and build the data set create awareness across the country, so your colleagues could start to identify this, work with local communities, and start to address the recovery and getting these children and young adults out of these environments.
Yeah. Yeah. No, it was in 2014. It was community agencies, domestic violence, law enforcement, others basically approached healthcare and said, we have an issue. We're dealing with trafficking. You're really kind of last to the table here. We need medicine's help. In the hospital system I work with, the Dignity Health, kind of stepped up to the plate in that regard and created a response program. And it was actually led by Holly Gibbs, who's a survivor of sex trafficking herself here in Sacramento. And I contacted Holly at that time and I said, I really think this needs to be part of my residents' education and training, my education and training. And I began working very collaboratively with her, and we worked on developing the protocols that we now use in our hospital settings and our clinic settings. And we went through training staff for many years. But yeah, I think coming from that primary care lens, it was very intuitive with the amount of trauma and abuse this patient population has had. They're going to need our ongoing help. And so we concurrently created within our medical space this medical safe haven, which is truly a relatively unique model of care. I work on many, if not most of the national committees from a medical standpoint dealing with human trafficking. And there are very, very, very few in the country, like 10 or less, providing anything like this type of care. And to my knowledge, this is by far the highest volume center in the country. As we approach 6,000 patient visits, that has created an enormous data set. And as we've done this and created our workflows, our medication treatments, our adjuncts, this is all survivor informed. So each step of the way, we've gotten input back from our patients, from our caseworkers, from law enforcement, legal. How can we be doing this to make this work for you? Like, how is this going to be helping? And so that process has been really, it's been very transformative for me in my career. And, you mentioned it earlier. I know hands down, this is going to be the most impactful thing I ever do in my career. So yeah, it means a lot.
So your program is clearly at this point a regional program, but the ultimate goal is to expand this education, and some of what you've already started across all communities around the U.S. and also globally, where you can begin to take this experience and share it and develop these programs. But I think it'd be important for the watchers and listeners to hear maybe a successor to from the program, from this massive data set that you now have collected. With that has come tremendous success out of the program. And I'd love to maybe turn this a little positive and share some of the examples of where the program and your impact has changed some lives.
Yeah, I mean, it's just, that's the real hook in this too, right? Is when you see somebody's life transformed, going in this new direction, um, that's the reward. It's very difficult to identify any patient that I've ever encountered that um, can use help more. And so it's a very, very wonderful process to see. I was thinking when you were saying that, I remember having a 16-year-old that came into me. She's 15 or 16 when she first came in, and single mom worked nights, and she brought her daughter in, and she was beside herself because her daughter was, being sold for sex by a guy actually that was incarcerated and his friends through these online services. And it was like law enforcement knows, FBI knows, but what can you do? Like, we don't have the resources built in our society to babysit somebody 24 hours a day, and so she kept getting herself into these situations, and seeing her come in and seeing where she was at that point, incredibly depressed, incredibly anxious. Um, just her whole self-esteem was tied into this commercial sexual activity. She dressed kind of like you would think a stereotypical commercial sex worker would be dressed, at that age. And working with her, working with community agencies, treating her depression, treating her post-traumatic stress disorder, getting her into peer counseling groups, trauma therapy, doing these things with her over the course of years. This took about 2 or 3 years. What you saw at the tail end of that was, 3 or 4 years out. I remember seeing her, and she's coming in very well put together, excited she's going to graduate high school. And, literally we're talking about like college applications, and I'm helping her fill out college applications. So, to go from there to there, that's a huge reward. Huge. So that's the payoff.
Yeah, and I know you've got the group has lots of stories like that, and we're gonna share some more of those in a little bit. I want to take a minute and explain how you and I got connected. MRP is coming up on roughly 8 years old from when I had this idea to jump back into healthcare e-commerce and put a focus on aesthetics. And over the years, we've looked at different ways that we could give back to the community. And I think companies have a tendency to look at the standard things and should you somehow get involved in renovating homes, or should you take care of a park or a street, or what things can you do? There's lots of ways people can give back, but MRP has a very specialized skill set, and that's that we can refurbish and repair and train and retrain and support and maximize uptime on energy-based devices. And we spent a lot of time trying to focus on, what could we do that we're good at that we could give back in some way. And we looked at a lot of different things. Believe it or not, one of the things I don't think you and I ever talked about was could we do something in alopecia? Could we do something kind of in hair restoration, which is a big impactful issue? And there was all kinds of things we were looking at, and we just kind of bumped into this human trafficking thing, and it really resonated because where we're based in Utah, and there's been a lot of visibility on human trafficking with some of the events that have happened here over the last decade and a half, and so it just started to pick up some momentum. So we were doing some kind of discovery and investigation, and started to talk to different groups, and came up with this idea of what we call the MRP movement, where we could basically take our resources and our talents and our skill set and start to give devices out to various programs that were very micro based in small regions, often with prison systems or whatever it might be. And we started to get some traction, and I happened to bump into your spouse, who's a dermatologist, at a trade show, and had shared with her what we're doing, and she was kind enough to say, well, it just so happens I'm married to the guy that's the leading expert in the world on human trafficking. And obviously might have embellished just a little bit, but she was granted some latitude, and that really started our discussion. And you shared with my team many more statistics than you shared on this podcast. And we left that call in tears and emotionally motivated to help in some way. And what we noticed is, in our experience, and then you validated this, is that these human traffic victims are branded. They're branded with scars, with tattoos, with marks, in different ways. And one of the stories we heard along the way is we were on this call once, and I had shared this with you, where we were on with a bunch of several human traffic victims that were through different programs, and they asked me on the call, on a video call, Scott, can you take care of these scars above our eyebrows? And I'm, well, we can solve that. We can take care of that. And I said, well, why does the scar? Where does that scar come from? She goes, well, that's when we get hit across the face and it splits our forehead open. And they said it with such casual, like it was such a common thing. And it just broke our hearts. And that kind of led to, we can provide CO2 lasers and erbium lasers and Q-switch and pico lasers for tattoo removal and pigment removal and all different types of pigment colors. And that led us to kind of talk to you about, let's us donate systems, let's donate training, let's donate services so we can put these systems in your programs and start to provide some of the recovery and the reminders that these victims have. Because as they go through the recovery, what I've learned is they look in the mirror and they see the brands and they see the marks and they see the scars, and it's a hourly or daily reminder of what they've been through, and they can't escape that. And so I would love to hear a little bit about how you think our partnership going forward is going to be able to help and accelerate and impact your program.
No, I mean, it's already made a huge impact. It's it's an incredible service to be able to offer. About, well, over 75% of our sex trafficking patients that are brought into our clinic were branded by their trafficker, typically with a brand that's, it's a sign of ownership. It tells the person they're a piece of property, right? They're not a person. It also tells other traffickers to stay away. They're already owned. And, as we kind of go through many of the things I was talking about, as far as mitigating trauma bonding, as far as treating complex post-traumatic stress disorder, as treating, STIs and the various ramifications. I mean, those things are all crucial, but then, that patient every day, like you just said, goes and they look in the mirror and they see a big tattoo on their neck or their forearm or wherever it may be. And the psychological impact of that on their recovery is enormous. And, it's just never been something I even had the option of doing anything about. And for us to be able to have this has been huge. And for MRPD to have come in and not only giving us the laser, and it was so funny working with my hospital system because, they're always nervous about new devices. And they said, well, what's the warranty? Like, who's going to do the maintenance? And you guys kept just thinking about emails and you're like, warranty's forever, maintenance is forever. It's like, well, can't complain about those parameters. And so, and then having people come in and get us trained and having our physicians trained, and then we train the residents, and being able to, again, do this, and to do it within what this medical safe haven has been wonderful, because we've had a few patients that actually already had tried to get a tattoo removed. I had one, and I don't want to get into the details too much because I don't want it to be, identifiable, but she had a large tattoo put on a big part of her back that her trafficker branded her there and then would beat her on that spot with a belt. And she had tried to have it removed at a center, at a place that was offering tattoo removals, and they kicked her out. They said, you're too emotional, we can't deal with you. And so for her to be able to come to our clinic and kind of have that safe space, safe providers, have her advocate there holding her hand, have us keep taking breaks, now we're getting it removed. And That's huge for her. And it's funny because it can be this kind of, very emotional, almost traumatic experience where we're all kind of in tears at the end of it, or it can be this real celebration, and so there's a pretty wide spectrum, but in the end, the result's always positive, it's good. And it's incredibly meaningful for the patients, incredibly meaningful. So I mean, it's been a wonderful service. And I can't thank you enough. And to be able to do this and put it into our programs, the amount of lives that we've can, expedite the recovery, it's huge.
A lot of people, given that I came out of kind of general and surgical healthcare over my career and I'm focusing on aesthetics, often people, give me a hard time because they associate aesthetics with what they see on reality TV shows. And that is not, in my opinion, what aesthetics is about. When we see a young adult or an adult that has significant acne scarring and their life is impacted significantly, ways that people that don't have acne scarring or had access to Accutane or treatment as a young adult or a young child or a teenager, and they didn't have that scarring, the impact to removing those scars through CO2, through ablation, makes significant changes in their life. And, we see that in all aspects, even things like hair removal can be very traumatic to people. And I know that sounds silly, but I'd love to hear just your view on aesthetics and your program and what the impact is, because as I shared, people look at aesthetics and they all they do is see what's on TV, and that's how they associate it. But here we're talking about aesthetics having a real remarkable impact on a very big problem.
Yeah, no, absolutely. And I mean, you think about the impact on the patient, but yeah, if a patient too coming from the community in which they live, having a Casper the Friendly Ghost on their neck means you're a trafficking, you're a, quote unquote prostitute. That's going to be something that they not only deal with personally, but there's going to be plenty of people within their community that are going to recognize that. So it definitely has far-reaching impacts in that regard. And I mean, I couldn't agree with you more that so many things that that reality TV would trivialize. We have young adults with vitiligo that are adolescents that won't leave the house, and to think that that's a cosmetic condition. I mean, the mental health impacts it has is enormous. So all of these things are really, really crucial to getting past these situations. And the tattoos, I mean, again, if you just think about like what that means to have some guy's name or symbol or woman's name or symbol tattooed on your face where you're looking at it every day, and it's the person that beat you, raped you, exploited you. I mean, to look at that, the amount of trauma that does each and every day is huge. And to remove that, I mean, big piece of the person's road to recovery.
You've been kind enough to bring in one of your patients into this discussion today. So, the community that's watching this can actually hear firsthand what the impact is to what you're doing and really the minimal support that we've given you. And I appreciate you thanking us, but it really goes the other way. We as a MRP community, both our staff, our employees, as well as our customers that have enabled us to do these things, we're grateful for the opportunity. And you had an opportunity to bring somebody in. And can you tell us a little bit about the patient that we're going to meet and the recovered victim that we're going to meet here in a minute?
Yeah, well, no, I've known Jeanette now for a little over 10 years. Take care of her kids. She's a wonderful person. And like you said, when you look for a success story, she's the wonderful success story of somebody whose life has gone in a dramatically different direction. I personally don't take any credit for any of that, though. I mean, that's her. It's her story. It's her road. But yeah, I'll let her speak for herself, Scott, honestly. She'll do a much better job than I will as far as explaining the impact and especially what this treatment has meant for her.
Hey there, guys.
Hi, Jeanette.
Hello.
Jeanette,
Hi,
good to
Dr.
meet you.
Chambers.
Scott
Good to
Carson, good to
meet you
meet
too.
you.
Nice to meet you, Scott.
Yeah, Dr. Chambers and I have known each other for, I'm guessing, coming up on almost a year. It was actually, I met Dr. Chambers' wife. I've talked to her over the years, but I've actually never met her till we were at a trade show in Vegas, and she introduced me to Dr. Chambers, and we connected several weeks later, and we started to hear about his program and how we could potentially support and help him. But we spent the last basically 45 minutes or an hour just talking about the program that he's developed and the education that he's put in place across the country and across the globe. And your story is so important to kind of anchor what we've been talking about for the last hour. So I really appreciate you coming on and putting some personalization on a topic that to so many of us is one of the most important issues in the U.S. that we need to address. So I very much appreciate you taking time, and we won't take a lot of time, but I'll dive right in if that's okay.
You're welcome. Thank you for having me as well.
Jeanette, I think everyone would like to hear kind of your story, just your background, and then we'll talk a little bit about how the program, Dr. Chambers' program, stepped in and ultimately helped removing some tattoos and what the impact is. And then ultimately, I'd like you to share some comments with some human traffic victims that either are in recovery or are not in recovery yet, and what message you would have for them. But if you could tell us a little bit about your story, and I'd love to hear it, and I think everyone would like to hear it.
Well, my name is Jeanette Diaz. I am 32 years old. I was 12 years old when my mother trafficked me. I was an addict from 12 to 18, which was really hard on me, not knowing where I belonged and where the person was that was supposed to save me and help me. It was really hard, going through that at such a young age, because in our eyes, adults are supposed to be there to protect us and help us get through these things. And for me, I was just searching for that, which kept causing me to be re-trafficked because I kept wanting somebody to love me and wanting somebody to nurture me and wanting somebody to care about me.
And the pause I have, Jeanette, is most everyone listening to this can't even imagine the environment we just can't imagine it. So how did this kind of just start? What was the was there just not parents around? Was there parents around? Was it I think people would like to understand where it started and maybe why.
So I got taken away at the age of 5 years old, which caused my mom to become an addict. So I was a ward of the state already. I really wanted my mom, being a young girl, you want your mom, you want your parent. And I went and found her. I ran away from my foster home. I went to go find her. I found her on Stockton Boulevard in Fruit Ridge, where she was sitting by a tree. She barely even knew who I was when I came up to her, until I walked away. Then she basically coerced me and was like, "This is okay. You can help mom." And in my eyes, people have done this to me before in foster homes. I've been raped and molested in a lot of foster homes and nobody protected me. So, in my eyes, like it didn't feel right. But because my mom was the one, like, "Oh, it's okay. It's okay." In my eyes, I was just trying to help my mom, which led my mom to force feed me methamphetamines, um, to be able to. There was just, she would take me to this one house and a lot of people would come. She would make sure that I was super, super high, just basically where I couldn't feel, I couldn't really, anything like that. Um, so it kind of made it a little easier on me to be able to sustain that kind of thing. Um, the reason why my mom got caught was because she was selling me to an undercover police officer, which the article was out in the Sacramento Bee. Going through those kind of things, you're basically just being re-raped over and over and over and over again, and not necessarily like not having control over your body, not having a say so of if this is okay or if it's not okay. You don't have that. It's either you're going to do this or you're going to get beat up, or you're going to do this and you're not going to have nobody, or you're going to be tortured. And so for me, I would try to do my best to make as much money as I could, to do the things I could do, because I didn't want to get beat up because I was $5 short on $1,000. And so a lot of it is just basically you have to do what your pimp says. You can't look a male in the eyes. You're not allowed to look a male in the eyes. You literally have to keep your head down. If your pimp catches you with your head up, looking at a man directly in the eyes, that's automatic grounds for getting beat. Automatic. It's disrespectful to them. It's demeaning to them. So for the longest time, I caught myself not being able to look at a male in the eyes. I would look down and I would have a full conversation with them, but my head would be completely down and I'd be just in a box, basically like I can't do this. I can't have a conversation. I don't want to look up and accidentally even try to basically have like how I can do right now. I wasn't able to do that then.
I'm sure you've heard this many, many times is I am so sorry to hear your story. And as father of daughters, it's hard to hear. And you mentioned that you were 32 years old. I want to understand I think that I've got conviction and I've got heart and I've got motor and character. And then I think about you, being a drug addict between 12 and 18 and now being 32 and being a recovered traffic victim. How did you get out of that? How did this change for you? Because it seems almost impossible from what you described. How did you get through it? How did you recover? How did you get to where you're at today?
Well, I got pregnant with my daughter, which basically I was damaged goods because I was pregnant, which my abuser tried to personally take my pregnancy away from me by throwing me down a flight of stairs. Honestly, it's places like Dr. Chambers' office that has given me my purpose back. When I was able to meet Dr. Chambers, I felt disgusting. I felt worthless. I didn't know anything about getting checkups. I didn't know anything about even woman checkups, regular checkups, anything like that. And for a man, to make me comfortable with my health care, to be able to, hey, you got to get these checkups, you got to get this blood work, you got to do that. That was the first step for me because I didn't know how healthy I was. I didn't know if I had STDs. I didn't know if I had this, and I didn't know if I had that. And so coming into an office like Dr. Chambers, he made me comfortable. He was the first man to make me comfortable with my health and to show that he cares.
That's how I know Dr. Chambers that's how I understand the program and the impact. What would have been the path if you wouldn't have had the opportunity to get the care from Dr. Chambers and his team? What would have been the path that you would be today at 32?
I probably wouldn't be alive today. He's helped me a lot. I'm sorry if I get a little teary-eyed, but
Jeanette, I'm teary-eyed and I'm heartbroken. I'm absolutely heartbroken. So you,
You always make us cry though.
I'm sorry, guys.
She's
Anyone that knows me knows that I'm not at a loss for words, and I am, Jeanette, I'm just heartbroken. So you're on this amazing path. I'd love to know a little bit about your life today. I'd love to know you're alive and you're thriving and you're talking to Dr. Chambers and myself. Tell us about some of your successes and tell us what's happening in your life today.
Well, I have a lot of great successes. I am on the Survivor Advisory Board. I'm co-chair on the Survivor Advisory Board for Three Strands Global, and I also am the receptionist for them, which we are a nonprofit to help the prevention of sex trafficking, which is very dear to me. I'm utilizing what happened to me to be able to be resourceful and to help other people understand that, hey, we can be the lowest of the lowest person of how we felt at that time, but we can get our life back. There's, and there's a lot of places like Dr. Chambers, like his staff, that not only are they here for medical reasons, but they have conversations with us. They let us know, like, hey, he's even got my daughter a Christmas present before, So having people like this and knowing that I'm somebody now. I have a title. I'm not Jeanette the survivor. I'm Jeanette the receptionist. I'm Jeanette the voice, And so I've been able to take back my voice that I lost for so many years. And now I'm able to utilize my voice to help other survivors or other people that are still being trafficked in this moment to understand, like, we can be somebody, we can make it, we can do it.
Jeanette, you are somebody, and not only are you somebody, you're a powerhouse, an absolute powerhouse. And I'm inspired and I'm motivated at a level I haven't been in a long time when I think about the things that you and other victims have overcome. For you to be part of a team that's helping them recover and get into society and have a great life like you've defined. I would, I don't want to minimize your story, but we do want to communicate to physicians and clinicians and providers what impact scar removal, tattoo removal, pigment removal, brand removal has on recovered or recovering victims through the process. And you firsthand have experienced it, and I'd like to hear just briefly, because this is a small part of it, but just briefly what impact that has had personally on you.
I'm me again. I'm not Jeanette with branding on my hands anymore. I'm not the tattoo on the back of my neck of a name that they forced on me. I'm able, every time I get my tattoos removed, I cry because I'm unbranding. I'm not that person anymore. I'm me. And it's giving me to be able to say I'm me. I don't have to worry about, because one of the tattoos were on my hands and it's almost fully gone now. And it was a big hurt to me to have to look at my hand and look at a pimp that caused so much pain in my life. And it's been able to it's like a breath of fresh air every session. It doesn't feel good while it's happening. But it's just, you guys are giving me back. You guys are giving the Jeanette, the innocent Jeanette back. The Jeanette that doesn't have to be somebody's property.
What would you like to share, at 32, having a career, having impact? What would you like to share with victims in recovery today? What would be your message?
I want to tell other survivors that you will get empowered by getting your tattoos removed. You're gaining yourself back. we don't have to keep these thanks to MRP for donating something like this and helping us gain who we want to fully be back into society.
Jeanette, as I shared a moment ago, there's few things in my life that impact me. I can't even think of anything that's impacted me more than this discussion over the last few minutes. And I'm grateful and thankful and privileged that you took the time and had the courage to share your story and your progress and your success. And I genuinely believe that this is going to change thousands of people's lives. You are going to motivate them and inspire them and to find care as they're having difficult days, as I'm sure you did. They will be reminded to stick with it and fight through it, because you are the example of the other side. And I want to thank you for taking the time, and it's so great to meet you. And I am confident that we are going to meet personally, and we're going to work together. And I'm going to get behind you and your organization and see how we can expand this and really impact other victims. Dr. Chambers, is there anything you'd like to share before we wrap up?
No, I thank you, Jeanette, for being here. You're very kind. I don't think I have anything else, Scott. I do know that I think the one kind of just piece that people do ask, like, what do I do if I see somebody tomorrow? And there is a number. It's the National Human Trafficking Hotline. It's 888-3737-888. And calling that number will take them to resources in their community that could help that individual. And that's probably a or at least a safe thing to do. If you found somebody and you didn't have a way to help them entirely, you could help them memorize that number, and they could call when they had a chance. But I think that's a takeaway number that everyone should try and memorize. It's very easy. 888-3737-888.
I think the entire clinical community would love to know how they get involved and contribute to what it is that you guys are doing at Medical Safe Haven and Dignity Health. Is there kind of a next step that you could think of that, or there is a next step that you would suggest that your clinician and provider partners do?
Yeah, well, if for like, we have all of our information, everything from our protocols to recorded lectures to all kinds of information on how to implement this into your clinical practice. We have a whole book. It's all available on our websites. It's dignityhealth.org/MSH clinic. And that has actually a separate link that goes to another website, which is just simply dignityhealth.org/MSH. And that one's really built for medical providers to be able to utilize all the resources we have. It's all free. Take our name off, put your name on, kind of thing, so that you could hopefully work for, towards implementing this care too.
We'll show that up, that information up on the screen as well.
Okay. Oh, and I would probably say also Jennifer.Cox@commonspirit.org would be our contact person who could, direct any questions.